Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Ryan Fox, the Strategic Director of Virtual Care at Home at GE Healthcare. Ryan, how's it going?
Great. How are you?
I'm doing well. Excited to chat with you here today. Why don't we dive right in? Would love to hear kind of a brief overview of your background, and then we'll get into the conversation.
Yeah, that's great. Well, thanks so much for having me, Jared. Really excited to talk to you today. I've been in healthcare for about 20 years and more recently have joined GE Healthcare, focused on the virtual care at home offering. I think my role is really focused on helping with this evolution of the care delivery model and embracing the home as a pretty meaningful site of care. And it may be a little surprising to hear GE Healthcare is focused on this, but we recognize that as healthcare is evolving, GE Healthcare also has to evolve. And so I'm just excited to be here on the ground floor and helping with this evolution.
You say that, but I'm more surprised when I find out GE isn't involved in a particular area of healthcare. Because I feel like you've done a great job of covering like so much of the space, right? Whether it's the care at home, it's the devices, it's the virtual care. So I think GE is always ahead of the curve when it comes to looking at where is healthcare heading and all right, let's get involved in that particular area. But I'm sure it's not without a lot of internal discussions to get to that point, right? You're going to do something, you do it right.
Yeah, for sure.
I wanted to kind of kick things off. Would love to hear, I guess, recent industry market report that you put out with it was with Sage Growth Partners, scaling post-acute care opportunities and obstacles. Talk us through that recent market report. Kind of give us the general overview of that. And then I guess actually before you go into that, I totally forgot to ask you my follow up thing. Um, for anyone that hasn't heard of GE Healthcare Technologies, give us that general overview, and then we can talk about that report. That's my bad.
Yeah, so GE Healthcare, has been in healthcare business for over 120 years, and we're really experts on the inpatient suite of tools, technologies, and even services, all within the four walls of the hospital. It's a very broad ecosystem of different types of solutions, whether it's our digital CMU or our Mural platform. We're very strong across basically every facet of healthcare as it operates within the four walls of the hospital. And so that's a little bit about GE. I think you kind of nailed it earlier, Jared, that we do try and stay really at the forefront of evolving technologies. We're also constantly looking at things that are happening from a regulatory and legislative perspective to ensure we're staying on top of those types of issues. And we also make a lot of strong commitments, both at internet or state and federal levels, just to ensure that we're staying right there in lockstep with the care that our patients need and that our customers are looking for GE to help provide.
And and when it comes to this recent report that you put out, like what was the let's assume that there's people listening that haven't checked it out yet. I'll put yet there because they should definitely check it out after. Uh, Give us kind of some of the snapshots, like maybe some key findings, or why did you want to put together this? Like, what was the methodology behind this report in the first place?
Yeah, I think, it was. So let me back up a little bit. I think,
Mhm.
as we emerge from the COVID-19 pandemic, there's been a lot of talk around what does the future of healthcare really mean? And, are we going to return to pre-pandemic capacity levels? Are we going to see that telehealth is going to kind of shrink back down to, lower rates? I think there's been a lot of speculation around just, how is healthcare going to look following the COVID-19 pandemic? And so there was a lot of interest to really begin to talk to some of those frontline leaders at a variety of different health systems all across the country and just get their perspectives broadly. And so that was a little bit of the genesis of the report, is just to say, you know, healthcare is changing, right? We're starting to see more and more older Americans. We're starting to see newer care models being delivered within patients' homes. And we wanted to get that perspective from those health system leaders. Exactly how is your health system responding to these changes and how involved are you getting? And so I think, that was one of the first bullet points that came out of that report is over 80% of the respondents said that they're moving lower acuity patients into the home. And I think that was just an indicator that this is happening at a much quicker pace than maybe we expected across the United States. So that was one of the probably most important points that really came out of that report.
And I guess for additional takeaways, why someone should dive into this particular report, is there anything else you want to signal that maybe will pique their interest? Obviously, it was a great. You guys definitely went through and put together a lot of research here to compile all the findings in this. Um, but anything else that you want to add to that before we move on?
Yeah, I mean, the report was really looking at not just shifting care into the patient's home, but what types of care is being delivered within the patient's home. Is it a true high acuity use case like hospital at home through the CMS waiver? Is it just simply trying to shift some of those patients that have been in the hospital for some period of time and now they, maybe can go home a couple days earlier from the hospital and finish that level of care at home? Or is it more of the remote patient monitoring that we're much more familiar with in the industry, where that could be a 90-day view of RPM trying to prevent rehospitalizations? Is it a longer term chronic condition management type of view of RPM? And so the report really spans a number of different areas and tries to get some key findings from those different health systems just to indicate where are you beginning to put most of your emphasis? Is it more on the RPM side? Is it more on the hospital home side? And then what are those things that need to change in order for you to put more investment into those different areas? So we kind of hit on all of it. It's a pretty comprehensive view of just overall what does that care in the home look like and what are the different flavors of care being delivered.
When we kind of look, what are some things? Obviously, this was whenever you do these reports, it typically focuses on what's already happened. What do you and also I know you did talk about what could happen in the future, but what are some of the things that as it when it comes to scaling post acute care that we should be on the lookout for in years to come?
Yeah, I think there's a couple different things. So one, as it relates to the remote patient monitoring space, there's been about 400 different RPM type of companies out there, and so it's a very complex space. A lot of different players out there, and it's had some limited reimbursement rates from a CPT code reimbursement perspective. And so I think one of the things that we've really learned over time, and some organizations have been much quicker to adopt this, is that it's not really about the CPT level reimbursement. That's not really the reason why you would implement an RPM program. It's about total cost of ownership for those patients, total cost of the care that's being delivered. So if you can prevent readmissions, if you can help, taper off frequent ED visits, if you can help alleviate some of that exacerbation of the emergency department and get some of the patients out of the hallway of the emergency department, those are the types of ways that we need to be thinking about delivering care into the home, not just focused on individual, CPT codes. So I think that's been a piece of it. And so one of the big things that we'll begin to continue to see here is that the number of RPM vendors and solutions that exist out there are really going to start to shrivel, because I think what we're starting to see and hear more often from hospitals and health systems is we're looking for this broader platform play. We don't want to just focus on RPM anymore. We really want to be able to provide high acuity all the way down to long-term chronic condition management, anywhere on that acuity scale. And so GE spent a couple of years looking for a partner in this space, and we kind of dipped our toe in the water with some other solutions, and pretty quickly found that we need to be in this capability where we're providing connections to various different solutions across our portfolio. We need to have various different capabilities across acuity levels. We need to be able to provide clinical nursing support for folks that are dealing with staffing shortage issues. And I think that's something that we're just constantly hearing from our customers is we want that broad range of different services, technology, and solutions, not just a very niche specific, you know, piece of the market that you're focused on.
And what I guess should hospital leaders like? What do they need to recognize when they look at that need and value of stronger uh, post acute care models? Let's specifically focusing on like these recently discharged patients. Like what should they be recognizing?
Yeah, I think what we can really recognize is that number one, patients prefer to be home, right? Anytime patients can get out of the hospital a little bit faster, they're definitely happier. I think a couple of things that we've seen from this earlier discharge model is one, patients are more compliant with their discharge instructions when they go home and finish the last 1 to 2 days of their level of care at home, because you still have that direct connection into a nursing team leader somebody helping facilitate that discharge process a little bit more efficiently than just kind of a pure cutoff, right? Leaving the hospital and going home. It's no secret that as patients are being told that they're going home, that's usually when their brain kind of shuts off and starts thinking about, what are the things that I can start doing at home again? And they stop listening to all of their discharge instructions. So I think that's one big piece. Another one, though, is directly tying it back into how the hospital operates. And as you think about capacity challenges and the number of patients that are just waiting in emergency departments, if you can get these patients out of the hospital a little bit faster and free up those beds for the higher acuity patients that are waiting for those beds, you're going to operate so much more efficiently. It does elevate the acuity level of all the patients in the hospital and requires nursing to be practicing at the top of their licenses. But I think it helps streamline some of that efficiency for the hospital overall.
Ryan, do you have a dog?
I do. Did she just run down the stairs?
I saw the legs just kind of go down. It was absolutely adorable just seeing the right down
Yeah,
the staircase.
yeah.
Um,
Thanks.
when like when I do want to talk a little bit about too, like, scaling post-acute care services requires a significant amount of time and investment resources. But it's critical as organizations seek to reduce that length of stay, right? Um, why, like, why aren't we talking about this more? I know, like, in certain circles we are, but what do you think is stopping us from discussing this type of thing a lot more than maybe we are today? Because it is such a crucial thing we should be focusing on.
Yeah. I think it is something that's becoming a little bit more of an emerging topic. There is a bill currently sponsored by Marco Rubio and others in the state of Florida to embrace observation status at home. So if that gets passed, then it will enable patients to be treated as observation in their homes. And so you can really think of it as an extension of the hospital at home waiver. So I think it is something that is being talked about more and more often, but you also have to have the right mix of technology and services and capabilities to be able to keep that eye on the patient while they're home. So there's a little bit of concern around, just purely sending patients home with nothing. And that's certainly not what this timely discharge or early discharge model of care is all about. Right? You want to be able to kind of maintain that constant view of continuous vital signs coming in, having some nursing engagement, doing some symptom tracking. Um, so again, your overall goal is trying to free up the beds, but not doing it in an irresponsible way. And so there is a little bit of a culture shift and just a shift in the way of thinking about patients don't have to be in the hospital to receive 100% of their care any longer. And so that culture change is what sometimes can prevent the scaling of the programs. But I also would say relying on a partner that has thought through the technology, the logistics capabilities, the ancillary services coordination, any nursing support staff, presenting that holistic picture is going to be one of your keys to success in scaling your programs.
Obviously, healthcare is going to change significantly over the next 10 years. We always see these changes like to happen, but even much more so over the next 10 years. Um, we continue to struggle with increased demand on the system from sick patients while also recognizing that the reduced workforce is going to bring its own strains to the hospital. What are some other things that we need to be aware of over, like, let's say, the next 10 years? This is your super forward looking hat that we're asking you to put on. What are some of the things that we need to be focusing on?
Yeah, I think there's a couple things that we can turn to. One is just overall reimbursement levels. We know that delivering care in a patient's home is a much lower cost setting than delivering that same degree of care in the hospital. And so I think some programs have been hesitant to get into a true hospital home type of program just purely because, it's been a 1 year waiver year over year. And so there's a current bill proposed in Congress that is a 3 year extension of the CMS hospital home waiver. And if passed, then I think that's going to signal a much more greater strength and belief and permanency that's on the roadmap for hospital home. So I think if that comes through in November, which we believe pretty strongly that it is going to come through in November, we think there will be a lot of additional programs that are sign on as part of that. So that'll be the first piece within those 10 years that you ask about. The next one I think is around some devices. And, I think there's no shortage of new startup companies out there that are coming out with their devices. But a lot of these devices today are individual parameters, individual vital signs. There's not a ton out there that are doing kind of that holistic approach. And so I think we're going to start to see a little bit more of either consolidation of the vitals into one form factor, or we'll start to see more and more like camera, AI, AR, those type of technologies, maybe even ultraviolet or other types of technologies coming out. But we'll see a lot of shakeup in the devices that are coming out here to enable these programs too.
Well, I'm excited to stay in touch with you, Ryan, and to continue to look at how healthcare continues to evolve. Really appreciate you coming on the show today and sharing your thoughts, and we'll definitely have to stay in touch.
Great. Well, thanks so much for having me, Jared. Looking forward to talking with you and catching up on things as we evolve.